The last vital sign is oxygen saturation. Patient oxygenation status is assessed routinely using pulse oximetry. Oxygen saturation, also referred to as SpO2, is a client's oxygenation status measured by a pulse oximeter. SpO2 estimates a person's oxygenation level based on how much hemoglobin in their red blood cells is saturated with oxygen. The target range of SpO2 for an adult is 94 to 98%. For patients with chronic respiratory conditions, such as chronic obstructive pulmonary disease, COPD, their normal range for SpO2 is often lower, e.g., 88% to 92%. Although SpO2 is an efficient, non-invasive method to assess a patient's oxygenation status, it is an estimate and not always accurate. For example, severe anemia, i.e., decreased level of hemoglobin in the blood, or decreased peripheral circulation can cause an inaccurately low SpO2 level. A pulse oximeter includes a sensor that measures light absorption of hemoglobin to estimate oxygen saturation. See the image of a pulse oximeter. The sensor can be attached to the patient using a variety of devices. For intermittent measurement of oxygen saturation, a spring-loaded clip is attached to a patient's finger or toe. However, this clip is too large for use on newborns and young children, so the sensor is typically taped to a finger or toe. An earlobe clip is an alternative for patients who cannot tolerate the finger or toe clip or have a condition, such as vasoconstriction and poor peripheral perfusion, that can affect the results. Fingernail polish causes inaccurate measurement and should be removed from the nail of the finger being used for measurement. When documenting a client's oxygen saturation level, it is vital to document if the client was receiving supplemental oxygen or if the reading was taken while they were breathing room air. If supplemental oxygen was being provided, the type of oxygenation device and the amount of oxygen being delivered should also be documented, e.g., oxygen saturation of 90% while receiving oxygen via nasal cannula at 2 liters per minute.